Okay, we're recording live.
Hello, everybody. We are super stoked today. Our guest in 2007, his last year in chiropractic school, was dealing with debilitating back pain. He was advised to get a spinal fusion surgery, but instead was driven to help people in the way that he needed help. So he decided to create a solution. This solution that he came up with is the catalyst for his life's work, which is now known around the globe as foundation training. Guys, if you like what we're doing here, please like and subscribe. Our sponsors today, Creekside Health. When in Whistler, check out Creekside Health, and the Pelly Clinic in North Vancouver. When you're in North Vancouver, check them out. Focus on the body's innate potential to live life of total wellness. But without further ado, thank you so much for coming on. We are so stoked. Dr. Eric Goodman, how are you doing today, man?
Well, I'm so stoked now after that introduction and that was a great little setting. I'm feeling good, man. I'm happy to be chatting with you guys. Thank you for having me.
Thanks, brother.
It's kind of funny. We've had a few guys on that Devin's introduced there, and they go, "Can you just follow me around everywhere and introduce me everywhere I show up?"
Just so stoked. I'm just so stoked.
Who needs theme music?
Yeah. There you go. Exactly.
No, we are really, like Devin says, we're really stoked to have you on, Eric. This is fantastic. And I could go on here, but what we do first in our show is we do something called Two Truths and a Lie. So I'm going to read out a couple of statements here, and Devin and I are going to have to guess which is the lie. Okay.
Go.
Okay.
All right. So here we go. Number one. Ready, Dev?
Yeah.
Okay. Eric is the author of not just one, but two best-selling books. Mm-hmm. Number two, Eric has worked with Olympic teams and world champion athletes, including Kelly Slater. Oh, we love Kelly Slater. Yeah. Big. Number three, Eric was on the 2012 U.S. Olympic men's volleyball team. Gee whiz. Okay. And number four, I got a fourth one in here.
Yeah.
Eric's much older brother is John Goodman. So Dev, what are you thinking?
Well, I don't think his older brother's John Goodman. I don't know why.
Right.
That's thrown in there. But also, I think there might be another one here, because I know, you're the water polo guy. So I don't know if you were working in volleyball as well, but maybe there's a little switcheroo of the words there. So, but two bestsellers, yep. And then working with Kelly Slater and Olympic athletes, yep. So I'm gonna go with I guess 3 and 4.
3 and 4, yeah.
Yeah,
I'm gonna go for 3 and 4 too. Was the Olympic men's volleyball? Yeah, because you're right. I think Eric here's done a lot of water polo stuff, but volleyball, well, maybe it goes hand in hand. I don't know, but I'm gonna say, that, and then the John Goodman as well. Yeah. So how do we stand there, Eric?
Yeah, I think all of it's pretty close. I'm a big guy, but I'm not big enough to play volleyball, and I can't jump high enough to make up for my lack of height. So that one's out.
Oh,
and
right.
John Goodman, I think, is more my dad's age than my brother's age.
So he's your father. He's your father.
John Goodman. Benny Goodman is my father.
Benny Goodman.
Yeah. No, my father is Bradley Goodman. But no, I've written a couple books, and in our health field, in the categories of pain management and strength development and things, they did wildly hit some nice. Just they sold and they got out there and they helped me build this idea of foundation training.
Right.
And I was, I worked with Kelly in like 2010, 9, 10, 11 ish, 10, 11, 12, something like that. And we remained friends, and he still sprinkles in this work as needed. But he opened up the door he was one of 3 or 4 surfers that really opened up the door to the surf community. And I've been really excited watching how foundation training has grown within the action sports community in general. Namely the surfing world. It really has exploded in that world over the past 5-10 years.
Right.
And I feel very grateful I feel very grateful for the arenas that it has bled into. And as far as water polo, I was the doctor and strength coach for the U.S. water polo team, the men's water polo team in 2007 and 8 for Beijing.
Oh, okay.
But I wasn't on the team as an athlete. I was the strength coach and doctor, and one of the training staff and coaching staff for the team, which was a really wild experience, as I played high school and college water polo, but I didn't play anywhere near the level of these guys. But it was really fun to be able to understand, get in the water with them, mess around, and also see a very legitimate difference in skill set.
Oh, that's really cool. We because we just had the Olympics recently, and one of our friends' sisters was on the U.S. Olympic female water polo team.
They are dominant.
Yeah, they just killed it. She's the backup goalie, so maybe she's gonna work her way into. But yeah,
they're the real thing. The women's water polo team in America has been extraordinary for years, from the coaching to the athletes. They're incredible. They really are.
Wow. Yeah, Dev. Sorry, Dev, you had a question there?
Yeah, we're gonna start off with a few questions here, but I'm gonna go back to the beginning. I know it's been a long journey for you over like 13 years of developing this practice that is now foundation training. But I think what the people want to know is what started this, and like let's go way back as far as you can remember yourself as like a young man. What was the drive to start this?
Yeah, I think the drive to get really creative with it was pain. But before that, the drive to get into healing arts and into like eventually chiropractic and some other things was I was really enamored with the human body. And while I was very sensitive and I had kind of my own pain stuff as a young 20s, it was before that I got really interested in anatomy and physiology. And my dad had like old anatomy books growing up, and I would look through those even as, when I was 5, 6, 7 years old. I don't know. It was just a genuine interest in the body. I became a personal trainer right after I turned 18. As soon as I could, I got certified as a personal trainer.
Wow.
I just was very intrigued. And now I'm 40, and I've been in that pathway for 20 plus years.
Right.
And learning and curiosity being, I think, the most important element by far of what I do. And what else can happen? What else can get better? What else can get worse? What happens if we do this? What happens if we do that? That's kind of been my whole journey with everything from chiropractic and training to what became foundation training and what foundation training will become. It's not a finished product. We're still going.
Exactly. So what exactly, for our listeners here, what exactly is foundation training? I know
it's protection. It's a way to protect the body's weight and mass against breakdown, wear and tear, and pinpoint focal point pressure that feels like hell in certain situations. That feels like the most debilitating pain a person can sometimes go through is the radiating pains of spinal collapsing, spinal compression, or hip compression, or sacroiliac joint compression, and the sort of onslaught and slew of symptoms that comes each almost obligatory level of degeneration later. There's another series of symptoms that is almost expected. And what foundation training does is it helps you control, understand, and almost mechanize the treatment and prevention of those symptoms. It helps you understand what compression does. It helps you understand how it feels to go into less compressed positions supported by strong muscles. And it lets you feel the strengthening of those patterns as you get better and better and better at those very specific poses and breathing patterns. So foundation training ultimately is a breathing pattern and movement pattern system that trains your body to absorb its own weight as efficiently as possible.
Right. So, I mean, I've had at least 3 of my good friends all have major lower back problems and all gone in for the surgeries. Right. And I mean, one of my good buddies, Sean, he was in the hospital and on these massive painkillers, and they couldn't get him in for surgery for like a week. So he's laying in the bed in the hospital. We'd go visit him, and it was horrible. And he had the surgery, and he's better. And then my back personally has been bugging me for probably, I would say, 5 years. It started with like a sciatic type thing, and then it got kind of worse and worse. And Devin, myself, and our family, we're all big, surfers and skiers and mountain bikers, downhill mountain bikers, and it was really starting to affect me. And I went into the clinic at Whistler, good friend of ours, Dominique Valet, has a clinic called the Creekside Health, and she's an acupuncture therapist, but she recommended that I do this foundation training, and I had no idea what it was. And she said, oh, it's only a 12-minute thing. You do it like every second day. And if you want to do it every day, you can do it every day. And I'm like, okay. And so I started doing this 12-minute routine that you created. And it's been absolutely amazing. I've been doing it for 14 months, almost every day, pretty much every day. And it's kind of, the spider web of it has gone out. So our family's doing it. My friends are doing it. And I mean, I'm able to ski, and we just got back from a 2-week surf trip, and not one little ping in my lower back. And so, yeah, it's been really, really, really cool. Yeah.
So what that tells me, that's really a great story, but that's also a microcosm of what the foundation training kind of ecosystem has become. You just defined a kind of the N1 experience that a lot of people have experienced over the years, and myself included, which is the vast majority of the pain becomes under your control.
Yes.
Yet you are still able to overdo it to where you have to then manage that pain a little bit more substantially, a little bit more intensively. But that understanding, that communication becomes like another language that you learn, to the point where you can really feel oncoming and outgoing symptoms. You can really feel the twists and turns alter.
Yes.
And after 14 months, you're probably starting to do that. But if you're only using that 12-minute video, you're not all the way there. You're learning kind of a superficial version of the work, which is great. And I'm very happy that works.
Right.
What we've been doing over the years now is we've been trying to take your friend who's laying in bed for a week, not really able to understand what to do, and he knows that weight bearing is going to hurt like hell. So we've really figured out how to be on your back and on your belly pain-free. And we've really learned how to open up and close the levers that allow pressures to be held at nerve roots or disc areas, instead of larger joints like the hip joint, larger curves of the spine like the thoracic curve of the upper torso, instead of the lumbar curve, the lower torso. That difference is life-changing, and at times life-altering for people.
Sure.
It allows this moment where your brain says, well, shit, I don't need that pain medication. And that moment alone might go away quick. And you might have 35 different individual moments like that in that 1 week in bed, waiting for somebody to do something for your back. But by the time you have 10, 15, 20, you're already having a different conversation with yourself, that there might be a light at the end of the tunnel, that you can control this better than your body doesn't hurt because of a lack of pain medication.
Right.
That's not the problem.
Exactly.
And you start to have this conversation with yourself. And the reason that foundation training exists is that so then when you start to have that, I want to do this myself conversation, you can literally read the book on it. You can literally follow the app or the program on it. You can literally point somebody like Dominique, who maybe didn't already know about, towards the certifications and things like that we offer, so that your community can have this option there. And that's why my work exists, is for it's easy for the people that are ambulatory and pretty used to taking care of themselves to take care of themselves. And you're a perfect example of what typically happens with that person. And I'm very proud of that example. But I really work hard on foundation training, because I think that the other 60+% of human beings in the world that are not as autonomous, not as self-aware, not as convinced that they have that capacity.
Right.
If we can get this subtle shift to begin bleeding into that community with the easiest entry points possible, hey, you don't even have to stand up. You can sit in your chair and do seated decompression movements. You can lay on your back and twist your hips in this way and spread your toes this way, and you will close the gates on your SI joint. You will stabilize the pubic symphysis at the bottom of your pelvis instead of compressing the lower L5 spine, L4 spine.
Right.
That's what happens. And we can start to help people understand it. Just like in math, there is an expected outcome when 1 or 2 things or 3 things come together. in biomechanics, there is an expected outcome when accurate movement supports accurate movement supports accurate movement. And we have, for 13 years, been reverse engineering that to the best of our ability. And I say our because it's not me, it's many of us now.
Yeah, you have quite the team now. Yeah.
We have a real
fantastic.
team.
Yeah. I'm actually going to throw up. I've got a couple of photographs because people that do watch here that we can.
Look at that guy with his long hair.
That's awesome.
So I'm just gonna throw this up here because it's kind of hard to explain. People foundation training. Okay, what is it? But if I go here, like this is, it's almost like this for me is kind of the start off, the stance, kind of everything that's built on is this position.
That is the namesake of the work. That's the founder.
That's the founder.
That is what. So I got to this. Now, number one, I got to this slowly and literally painstakingly.
Right.
But it started with the chair pose in yoga. And it started with the chair pose in yoga and this forceful extension of my own spine during it that gave me the first relief I had ever felt in my back. And that was in 2007.
Right.
And it was when I was still in chiropractic school. And it was at what I would consider the absolute pinnacle of my pain, where I had to take painkillers. I was not a happy human being. And I was really feeling that I had chosen the wrong profession. So when I see that pose, what I see is literally like my building of strength and confidence around an injury that I thought took me down the wrong path in life, but instead allowed me to kind of create my own path in life.
Right. Because I mean, this stance, and it's because you're back on your kind of on your heels and your back. I mean, if I feel my back's a little bit kind of a little bit twingy or twangy and whenever it is, I'll kind of do this and I'll do your your good mornings and all that, and it kind of just loosens everything up, and you can really feel it.
Yeah, if you're doing it well, it should feel like your torso is being controlled by your legs. And exactly. the chassis of you. There's a really powerhouse you're never ex-military, but non-active special forces military guy named Pat McNamara that helped me understand this idea of kind of he defines the lower body as the chassis and the upper body as the frame, everything else. And the chassis has to be extremely powerful and movable to support the frame. And I just think it's the coolest idea. And when I define the lower limbs as a chassis, it starts to make a lot of sense what the sensations of foundation training should translate as.
Right. Yeah, it's we've got another.
So that's just a basic decompression pose. So this pose, the lunge decompression, exemplifies the idea of anchoring the legs together. Like you're literally trying to use your feet to pull your pelvis towards the ground as you try to use the back of your skull, the chin, the rib cage, and the muscles that surround the diaphragm and expand the diaphragm to elevate and decompress the torso away from that low pelvis pressure.
Right. And then you go from this, which you talk a lot about, is decompressive breathing, right?
Yes, decompression breathing it's one of those weird. So decompression breathing came about in about 2011 and a half. If you watched it, I gave a TED talk in 2011, and it was the first time that I gave this idea of repositioning, using breath to reposition the rib cage as it interacts with the spine. So it's not a breathing exercise, it's using breathing to structurally reposition the rib cage in such a way that it more accurately disperses pressures around the thoracic spine, the 12 joints of the thoracic spine, which is the biggest curvature, the most accessible, most impactful area of the spine. Decompression breathing is a skill-based mechanical repositioning of those joints. And it's very hard to do. It's very, very hard to do. It's like, that's what I tell you. It's like, decompression breathing feels so good the first time. No, it doesn't. It feels painful. It's hard. It makes your back spasm. It's not easy. You have to literally, you're like pulling yourself apart for the first 2 months, first 3 months of it. And then it feels incredible. And it feels like you're holding your rib cage like a backpack instead of your rib cage holding the weight of your head. And
Right.
it's a nice feeling.
Right. Wow. Yeah, we've
It
been
just
actually
wraps you.
we've been doing some of the Wim Hof breathing, which you probably know about old Wim Hof there and crazy Dutchman. So
Well, it's a
I've been-
perfect Wim Hof is a perfect example of using the breathing as a chemical
yes.
exchange in the body, which is not what we, it's very different than what we do, but it's very important. And it's
Yeah.
So what Wim Hof teaches is controlled hyperventilation.
Exactly.
And what he also teaches is character and how to persevere and how to understand yourself and trust yourself. And that's probably his biggest gift of all for everybody. The Wim Hof method exemplifies him, which is this really caring, authentic, very inspiring person. And that's what I think is so cool about that method.
It's interesting because there's all these different methods and things that, Devin got me. I was having some anxiety stuff about during COVID. So Devin kind of got me into the Wim Hof breathing, and then we're doing the ice baths and breaking through the ice.
So here's my question. How did Wim Hof do for anxiety overall?
It really helped me. It really helped me. Yeah. The breathing and settling everything down. And then, we got this book here, which is a fantastic book. This
is that James Nestor?
James Nestor's book called Breathe, which it's very powerful. Yeah.
Very powerful.
So I don't know. It's been a little bit of experimentation during COVID's been a tough thing for most of us, a lot of us, but also there's a lot of learning that was able to take place. So discovering foundation training during COVID, that's when it was during COVID. And it's really helped me and my family. And then from Wim Hof, learning about breath work and all this, but it's all these things put together to help create a better life for us. And
that's how it works. It's all the pieces. It's just like the body. You don't fix back pain at the back. You put all the pieces together in a more accurate communication style and setting in a better ecosystem. That's health. Health is an ecosystem issue, it's not this flower's unhealthy, this thing's unhealthy. It's the ecosystem needs to communicate a little bit better, with the exception of blunt force injuries and certain things that do occur. But in most people's chronic pain and autoimmune problems, there's an ecosystem malfunction at play.
Right. Yeah, I always plug my good buddy at Whistler. He's he's 68, and he does the foundation training, religiously. But then, 2 years ago when I ran into him, and this sticks with me every single day, is this, Nigel, it's not about beating your buddy up the mountain anymore. It's about longevity. It's all about longevity. And I'm like, you know what? He's right. It's just to be able to get out there and do it and just go and keep moving and having fun. And as we age, it's because a lot of people just shut down and that's it. I can't do that anymore. It's like, no, sure we can.
I think that's why we move so much, my wife and I, with our daughters. I think that we like to experience, just like a new relationship is fun at the beginning. And then just like anything, they become a relationship. They become normal. You're used to it. That's great. Okay.
Exactly.
Every time we experience a new environment, I feel like I want to move everywhere we go.
Yeah.
I want to move everywhere we go. Oh my God, let's live here. Let's live here. This is great. Let's live here. And I don't know. I feel kind of the same way about a lot of the health stuff that I learn and a lot of the different sports that I learn. And that's part of health right there.
It's
part of it. Living around a community that inspires you. Oh my God. When I was in Kauai, the community there, the health of the elder people that take care of themselves in Kauai is exemplary.
Yeah. Incredible.
Really, wonderful.
Well, we were really fortunate. I was able to set my business up back in 2014 to pretty much run without me. And then we took the family, we traveled for a year. And we went, we were off the grid. We were in, from Myanmar to Bhutan and Colombia, Argentina, like all over.
What was your favorite?
Planet. I know people ask, Devin, we got the question again.
Oh, it's tough. It's a tough one. It's like,
what is it?
Bali. We stayed in Bali for a while, and we surfed pretty much every single day in like warm water. So that was like pretty
perfect
nice.
Waves.
Pretty much, yeah. But there's a lot of really cool spots. Bhutan was especially really cool. Just very simple, happy people. And, there was one traffic light in the entire country, and then they like took it out because it was causing too many problems. So there's no traffic lights again. It's things like that, right? That it's just
that's so great.
The world through I know I use this one, but like people always say like put yourself in somebody else's shoes, but I'm like, well, you know, some people don't have shoes, so it's like put yourself behind their eyes and see through their eyes for a day, and it's just wonderful. It changes your perspective on everything.
Yeah.
So
Yeah, we were just
Absolutely.
so fortunate. I'd have to say three. I mean, I always say it's and like you just said about Kauai, right? You said that the amazing people, the places we go are just a background for the amazing people that we meet along the way, and that's really resonates. So for me, Devin said Bhutan. I loved Bhutan. Myanmar was fantastic. It was like being in an Indiana Jones movie 150 years ago.
Wow.
Dirt roads and Mandalay, and the food being cooked on charcoal, and having our family there. Like it was all about our kids. These guys were all there, and then Argentina and Brazil. Our daughter would live in Argentina because she's a big horse person, and they're big onto horses and out in the wilderness, and but it was just a journey with the family, and it's like what you're doing. It's really, really super. Actually, I wrote a book. I ended up writing a book during the
I saw
travels.
that in looking through your stuff. It's called Pete.
Take that leap, risking it
Take
all
that
for
leap.
take that leap, risking it all for what really matters, and what really matters is us and our families, and at the end of the day. So it was
Perfect.
It was
The leaps are the fun part. They're stressful and chaotic, but they also get you where you're going.
They are, and it like for yourself, to get up and go to Kauai, and now you're down in Florida and whatnot. But it's like you've got all these responsibilities, and it's so easy to talk yourself out of it in your own head, and it's easy. Oh, I've got all these responsibilities. But I had a coach. I was working with a coach for many, many years, and it was the last thing on my list was to set the business up and travel for a year with the family. And it got to that point, and I'm like, can't do it. There's no way. And he goes, why not? He says, well, because of this, and this. And it was all just a bunch of BS in my head. And so we put a plan together, and we were gone within 3 months, and we were gone for a year. And it was the easiest. Once we were gone, it was the easiest thing to do. But it was just taking that step, or taking the leap, whatever you want to call it. Right.
That's it.
Yeah.
Very cool.
Yeah.
The pandemic was the foundation training really took advantage of the time during the pandemic. We were fortunate that we had just put together our streaming app about 6 months prior to everything going chaotic, at about the middle of 2019. And it was starting to get enough subscribers to actually make a dent. And then over the pandemic, we worked extremely hard on 3 things. We worked on a very high level education for our certification course, an online guided 6-week prerequisite to the in-person certification for any upcoming students. We've now had one of those groups go through and get the full certification in person, and they were so benefited by that 6-week guided course with our core education team. And it's really kind of created a very interesting. I think we just hit the top of the field in movement and pain management education, as far as like in comparison to other companies out there, other education systems. What we just put out there is noticeably different, noticeably improved upon, and user friendly. And the outcome has been instructors that are very talented. So that was cool. We spent 18 months on that, and designed everything in and out. Didn't outsource anything. All of it was done in-house.
Wow.
And we also, my wife and I, finished 2 books. My wife just put a book out 3 days ago called Shaping Your Baby's Foundation, which is a very intensive encyclopedic guide to the first year development of life, and how parents can use that time to benefit themselves health-wise, everything from bonding to really like, this is how you strengthen your body with your baby along the whole way. And it's getting very good reviews, and that just got out there. And then I have a book coming out January 18th called Foundations of Health. That is basically everything I've learned over 13 years and it brings 10 of my patients into the story with me. And we discuss the 3 primary foundations of long-term chronic pain and autoimmune relief. Wow. And it's I'm excited for that one to come out. That's actually going to be the first audiobook too. We're doing a proper audiobook for it.
Nice. Yeah, those are fun. I did mine as an audio, and it's a lot of fun actually.
Nice.
It's a bit make a bit nervous at the beginning, but you get into the flow. It's fine. Yeah.
Right on.
So
Right
you
on.
have, so for our listeners here, so for foundation training, so what you did is you got it, during the pandemic online, but now you've got,
Yes.
and you've got coaches all over. I'm assuming
1,200 coaches.
got 1,200 coaches.
And it grows by approximately 25 coaches, 25 instructors every 3 months.
Wow.
So that we've been doing it for 8 years.
Wow. So now is this
9 years now.
this because COVID hopefully is moving on here, and so be in person, like you'd be holding like a group, like regular.
We just finished our 50th certification was our
Yeah.
first one after the pandemic, and it was just held in Boulder, Colorado.
Yeah.
It was in person. We followed all guidelines as necessary. We did the vast majority of the teaching outside in the beautiful Chautauqua Park in Boulder.
Wow.
Even though we had a big indoor venue, we just moved everything outside. We're about to host our 51st certification courses in St. Augustine, Florida. That's why I'm down here.
Yeah.
In about 3 weeks. And that group is about to finish their online guided study. And then they attend the in-person together as a group. Everybody goes through together. They attend the in-person November 13th and 14th.
Fantastic.
And then we have another one in Austin, Texas in March. That's our next upcoming course.
Okay. Yeah. Oh, that's fabulous. That's fabulous. So we can, so people can do it in person, and they can also do it online, right? They can subscribe and they can subscribe to a program and do it online if they can't get out of there.
The in-person is like, if you want to go and become a practitioner, an instructor, you're using this to help people. You want to get very well versed at teaching it, and you're planning to make this a lifestyle for many, many, many years to come. That's an in-person certification. The app and going to certified instructors or reading the book, that's for anybody who wants to just be a patient, just be a student. I just want to learn this. I want to get better myself. I'm not trying to change my career or anything like that. I just want to get better. That's what that stuff's for.
Right. Well, I mean, you're having a huge impact, and that's what we like to do, is we like to highlight people that are making an impact. And you've really had an impact on my life, and I really thank you and my wife. And Devin, I think you're suffering from a bit too much surfing. There the past
thing to suffer from.
Your back's a bit gnarly enough, isn't it? Yeah. But I mean, you really helped a lot of people. So, and I know, because you do what you do, right? And you don't actually probably hear all the stories from all the people on the fringes. And we're on the fringe. We're up in Vancouver, and I got all my friends at Whistler, but you've really affected their lives and made our lives a lot better. Cool. And so just, thanks.
It's my pleasure. And I am eternally grateful that foundation training is becoming what it's becoming.
Yeah.
I was the first life that it changed, I assure you.
Right.
And I'm going for the ride with all of you.
Yeah. No, thank you so much.
Everybody to get better.
No, it's wonderful. We're going to, sorry, do you have questions? Do you have a question there?
Mm-hmm. I got like one final question for you.
Can you guys see this storm coming in behind me here?
Oh yeah.
Oh yeah, baby.
It's pretty awesome.
Look at that. Oh yeah.
Yeah.
That just blew in.
Woo.
I can see the rain coming
pretty
down
quickly
there.
here.
Yeah.
It's coming.
He's gonna get blown off.
I think we got about 60 to 90 seconds.
Okay, go, Devin.
We'll do one more. Just what I'm so interested in, and I love asking this question to people who've had such an amazing life and had such an amazing journey. But what are like the one key point of wisdom that you've acquired over the years that you would go back to, that young man who is like obsessed with knowing about the body? What would be that one key point of wisdom that you would share with them?
About the body?
About just your whole life experience and what you've done and just everything, really.
So I guess your younger
First
self.
One is never dive into a shallow pool. I say that through life experience.
Oh boy.
As a water polo player, sometimes you do stupid stuff in high school. And I dove in, I looked across the pool and I saw it said 8 foot and I dove right in, but I didn't look down where it said 4 foot. I almost killed myself. Luckily I broke my nose and just kind of chip my nose and kind of chip some teeth and stuff. I got very fortunate. So seriously, don't ever dive into a shallow pool or shallow anything. The most important thing about the body though is actually it pertains to the same area. You can control most vectors of your body with excellent jaw and head positioning and neck strength. And if you have accurate neck strength, you're very likely going to have pretty decent rib cage strength, and it kind of follows down in a very efficient way. So if you're going to be working on your posture, the first thing you should be working on is the weight of your head being held centrally by the neck, not the back of the neck. The whole weight of the head is held in the whole cylinder of the neck. And that typically does a really nice job of initiating alignment in the spine and the hips. And from there, you can really build upon a lot. And if I had known that going into chiropractic school and in these different things, I would have been very different in the way that I adjusted, the way that I looked at adjustments. Can you hear that wind, Sana?
Yeah, we can hear it. It's coming. It's coming.
The last piece of advice is never try to outrun a lightning storm. Just go inside. So I'm going to say my goodbyes, guys.
Okay.
Absolutely.
Thanks,
for your
Eric.
time, and I'm glad you're all feeling well.
Yeah.
Thank you so much.
Super.
Man.
Thank you so much. Devin, you can wrap it on that.
I will. Yeah. And if you, see you later, man.
Yeah. You can log off. We'll just finish
you log
up.
off. We'll do a
log
little closing. Oh wow, what unbelievable. So the storm is obviously, you know, for those who are maybe watching, but those who are listening, there's a massive storm rolling in behind Dr. Eric Goodman there. So, but if you guys would like to know more about Dr. Eric Goodman, we're going to put all the links to everything in the description of the video. As always, check out his app, Foundation app, check out the book, the multiple books, check out his wife's book. We'll put it all in the links to the description, but other than that, thank you guys so much for listening, and have an amazing rest of your day.
Yeah. And I would just like to say, like, I know a lot of us have lower back pain, and we try with all these different medications and techniques and whatnot. But seriously, if you got some lower back pain, just check it out. Just check out Foundation Training by Dr. Eric Goodman. There's a YouTube video. It's called the 12-minute routine that I've been doing for about 14 months, pretty much every day. You only have to do it 2 days a week, maybe, but I do it every day, almost every day. And it's really, 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 really helped me out. I'm able to ski and surf and mountain bike and downhill mountain bike and do all this stuff that I've always loved to do. And I was having some really nagging, horrible lower back problems where I wasn't able to do it. So yeah, just give it a go.
You got back pain, give it a go. All right.
All right. Thanks, everyone.